Hello, I am Dr. B.B. Rao of Usha Clinic and founder of the websites cubemedicaldoubts.blogspot.in and dragmamedicaldoubts.in. In these videos, I am providing the basic knowledge about the commonly occurring diseases for the knowledge of the general people and for basic knowledge for medicals. Today I am going to discuss about the less common disorders of respiratory system including HAEMOTHORAX, CHYLOTHORAX, HYDATID and HYDATID disease. HAEMOTHORAX. Hemothorax is defined as a collection of blood in the pleural space. It is usually secondary to trauma but may also occur in other conditions as tumors and tuberculosis, etc. Physical findings. Physical findings are those of pleural effusion and blood loss. Treatment. Treatment consists of removal of blood and attention to the basic underlying condition. Chylothorax. Chylothorax is defined as the pooling of chyle or lymph in the pleural space. The usual cause is trauma to the thoracic duct, either accidental or surgical. Other causes include the congenital anomalies of lymphatic ducts, obstruction to the thoracic duct by enlarged lymph nodes or tumors. In rare cases may be due to tuberculosis or filaria. Signs and symptoms are those of pleural effusion. Diagnosis. Diagnosis is established by thoracentesis, where milky fluid is obtained. The differentiation from the accumulation of the fatty material is made by feeding the patient with the dye fat soluble D and C with the green number 6, which will color the chylous fluid. Repeated aspirations are required to relieve respiratory distress. Children become rapidly depleted of protein, fat and fat-soluble vitamins. Gross pleural fibrosis occurs with healing resulting in scoliosis. Contraction of the hemithorax. Ligation of the thoracic duct. Ligation of the thoracic duct is preferred when the conservative measures fail. Hydatid disease. Hydatid cyst of the lung is uncommon in children. Well-matured cystic development in hydatid disease takes a number of years. The lung cyst, which may be single or multiple, is usually secondary to the coexisting liver cyst and occurs mostly as a result of heterogeneous spread. Mostly the cyst in the lung is silent and asymptomatic, and the symptoms are produced only in a complication like the rupture of the cyst into the bronchus, rupture into the other contagious structures like the pleural cavity, pericardial sac, on rupture into the blood vessel onto the fulminant anaphylactic shock. Rarely, a secondary infection may supervene and complicate the picture. Signs and symptoms. The clinical signs resembles that of the cystic lesion in the lung, like impaired percussion note and bronchial breathing, and increased vocal resonance. The rupture into the bronchus may be evident by the history of a sudden coughing out of grape-like material. That's all about the rare causes of the rare diseases of the respiratory tract. Diagnosis. The diagnosis based on the finding of the radiology depends upon whether the cyst is in intact or ruptured, and degree of calcification of the wall. Cysts may be single or multiple and may be located anywhere in the lung. And if intact, gives rise to a homogeneous circular well-defined opacity. When the cyst ruptures, it produces a distinct radiographic picture described as water lily fire, where in the ruptured superficial portion of the cyst wall will float beneath the fluid. When there is a minimal breakthrough in the cyst wall, a characteristic concentric wave shadow in the upper part of the cyst, namely pericystic pneumo, is present. Total leukocyte count, differential leukocyte count showing eosinophilia. Cassoni's test. Immunological test like the Cassoni's test is positive only in 50% of cases. Complement fixation test and HAI test, or they may be done. Treatment. Treatment is essentially surgical with effective anesthesia help, and adequate positive pressure ventilation. Recent clinical trials claiming the broad spectrum anti-anthelmintic hybridazole in large doses even for 6 months is still under experimental consideration. That's all about the rare diseases of the respiratory tract. In the next video, we'll discuss about some other disease